this a run in your family?
Knowing your detailed family history and new advances in genetic testing can save your life. We'll discuss this important and life-saving issue on this week's Health Talk.
Stay tuned. We are up next. Welcome back to Health Talk. I'm Dr. Vicki Smetak.
And I'm Dr. Eric Mazur. We're back with Dr. Adam Ofer, and we're joined by one of his really remarkable patients, Marina Richardson. Marina, we were talking before the show. You have a remarkable story to tell.
Yes, Marina, welcome. Thank you for joining us.
Thank you.
So you are here for a very important reason today. You were diagnosed with BRCA1 mutation, and you came to Dr. Ofer shortly after. Can you tell us a little bit about what that process was like, from going from, I understand, for a different reason to see Dr. Ofer and then finding out about this issue?
Well, I always knew I was a high risk because of my family history. But I didn't realize how great of a risk I was in until I met Dr. Ofer. When I came to his office, things went a little bit differently than I expected. He focused on my family history.
You went to see him for a fibroid, right?
I did.
Really something you thought was just sort of a very common, typical problem in middle-aged women.
Yeah, absolutely. And by the time I walked out, I was kind of surprised. But he did such a great job educating me on BRCA mutation. He immediately recognized I was a high risk. We talked about fibroids a little bit. They were not emergent, so there was no great focus at that particular point in time, but he actually highlighted the fact that my potential BRCA positive results could cause me a greater risk at the moment. And he did a great job educating me.
Were you shocked? You went there for a minor problem and you walked out worrying about a hereditary cancer syndrome. What were your initial reactions to that discussion?
It won't happen to me. Everybody in my family had either breast or ovarian cancer. But it won't happen to me. I live a healthy lifestyle. I take care of my health. I see physicians of different specialties every 6 months. It won't happen to me.
And that's such a common story, as we were talking about earlier before the show. We all like to think of ourselves as being healthy and health conscious and eating the right foods and invulnerable. Right, so even with a family history, and you said you were quite familiar with your background, but still that sense of it can't possibly happen to me, I'm doing all the right things.
Right.
And luckily you got to where you needed to be at that particular point in time.
Mm-hmm.
Adam, is that typical for patients to sort of deny that they may be at risk, even though they know their own family history?
It's very typical. Yeah, I mean, we all like to think that we're just going to move forward and it's not going to happen to us. And I think a lot of times, we just don't want to face the reality. But
I don't. I mean,
putting your head in the sand really just doesn't help, right? And I think that it's my job as a doctor to try to explain to somebody that putting your head in the sand doesn't help, and we have very simple interventions we can take if you are positive.
Now, somebody said something to me once that was very helpful, and just to share it with others, is there's so much of our health that we can't control, where there are these, but there are some things we can do to control our health. We can eat properly, we can keep our cholesterol down, we don't smoke, we don't drink alcohol in excess. And now I think we have this new one of fully understanding our family history and understanding if we have a genetic predisposition to one thing or another. So I don't want to take time away from you, but this is stuff we can do to keep ourselves healthy. So keep telling us more about your story.
Well, when we talked about genetics, I kind of just didn't associate it to anything other than myself. But what Dr. Ofer did, and I'm so grateful he did, he kind of took it further. And he explained to me what happens to a patient with a carrier mutation. What happens to their children? You pass it on to your children.
And you have children.
And I have children. And what happens to future generations? He explained to me about the insurance landscape. If you do qualify, not to focus on that so much because you could be covered, but try to stay focused on the risk, especially given my age. He explained to me about the GENE Act, the Genetic Information Non-Discrimination Act. It is no longer a pre-existing condition. It is no longer supposed to be held against you at your place of employment. He kind of touched briefly on all of those points, and I sat there and I said, oh my God, one, I have no reason not to be tested. Two, I could pass it on to my kids, and that's what did it for me. And I said, let's do it.
So
And
at
how
that first
empowering.
visit,
Yeah.
you actually had
First
the test.
visit,
Yeah.
yes.
It
And-
just offers you so much empowerment at
Yes.
that point, although it's frightening at the same time, but it gives you
Yes.
that extra, push to go ahead.
And look, Marina's very brave, and she chose, the most aggressive approach. So she went on to have a laparoscopic complete hysterectomy,
Well,
removal
you
of both
tested
tubes and
positive,
ovaries.
and to tell, I'm sorry, I didn't mean to step
No,
on,
that's
but to
okay.
say you did test positive. Before we go on to this, how did you react to the test result?
I was not surprised.
So by then, you really, given your family history, this was,
Well, I kind of received education, and I went home, did my own research, and applied it to my family history. And when I did, I kind of knew I could be already in danger because of my age. My sisters were younger than me when they were diagnosed with breast cancer. So in my heart, I knew that I'm already treading dangerous waters. So I was not surprised.
so Adam, so what was the treatment?
She was not surprised, and she was incredibly brave. I mean, this is really an incredible woman, and she chose. So look, you don't have to choose the most aggressive approaches. You can do there are medications you can take to reduce your risk. Something as simple as birth control pills can reduce her risk for ovarian cancer by 50 to 80%. You can take medications that reduce your risk for breast cancers. Something as simple as yearly screening with MRI of the breast can very, very much significantly reduce your risk from dying from breast cancer. Or you can take more aggressive approaches. Marina was brave. She right away stepped up to the plate and said, I'm going to be alive for my children. It doesn't matter. Schedule me tomorrow. I'm going to be around for my kids. Take out those ovaries. Let's go forward. And she did that very soon after that. And look, the technology has changed so that it's not the old days. We don't make a big incision. We did her laparoscopic hysterectomy through a couple tiny little incisions using Da Vinci surgery. She was home the same night. I think
And we're running out of time, but I just want to make sure we get the surgery was a bit of a surprise, wasn't it? The
Yes.
results of the surgery.
Yes, they were.
Well, tell us.
Is that okay? Pathology did show that Marina already has microscopic cancer in both of her fallopian tubes, a finding that is not uncommon for someone in her age range with a BRCA1 mutation. But because it was found so early and microscopic, yes, her road is not super quick, not as quick as we wanted. She has to go through chemotherapy, but she will be around for her children because we intervened early.
What a brave story, and what an important message that you are getting out to everyone, Marina. It's really amazing.
I think for our viewers at home, you're going through chemotherapy right now, are you not?
Yes,
I mean, I was shocked
Yeah.
at seeing you because you look so completely healthy and happy. It's
I
just,
am
it
just so
shows that you
grateful.
can live through this and be healthy.
I got this second best thing. I wished I was a pre-viver, which is somebody who carries a gene but doesn't have the disease. But given my age, I am not surprised, and I got the second best thing, to be diagnosed with the rarest of all gynecological cancers, where they were still contained. But I think there's thousands of people who already developed ovarian cancer would trade with me in a split moment. I am so lucky, and just going with it and doing the best that I can.
I think we're all
Thank
sitting
you.
here with awe and admiration.
Absolutely.
And also with the message for people at home that know your family history, and if appropriate, you should be tested because it could save your life.
Absolutely.
Come prepared to your doctor's visit. Talk to your
Yeah,
family
come.
first.
That's such an important message.
I can't thank you both so much. This is such an important topic. We've run out of time. But when we come back, we will answer this week's health question.
Here's this week's health question.
Hi, my name is Ann, and I'm wondering how to make my bones stronger.
Question: what makes bones stronger? We've got an expert on the set because I guess women do suffer from weaker bones more often than men. Adam, do you want to give us a help with how people can make their bones stronger?
We were chatting about this earlier, and I think you hit the nail on the head. We tend to think about this when women are hitting menopause, and all of a sudden they think, uh-oh, I'm going to turn into my mother, and my bones are going to get weak. We need to think about it at a much younger age. We think when our children are growing up, we need to make sure that they're getting the right calcium intake then, dairy intake in the form of milk, cheese, yogurt, vitamin D, sunlight exposure. 10 minutes a day of a little bit of sunshine goes a long way. And I think we've created a problem in a way because we're so good with sunscreen these days that there's actually an increase in rickets, vitamin D deficiency. So we got to make sure that we're getting a little bit of sunshine.
Yeah, absolutely. That's an important point. I remember attending at least 2 talks in the past year where vitamin D was the topic of discussion, and how much we've kind of done ourselves a disservice in a sense. I mean, yes, we are preventing skin cancers and melanomas, which is such an important thing, but I think there's a happy medium somewhere where the kids are getting some sun.
I know it's not proven yet, but a lot of people are suggesting vitamin D supplements for many of the population, particularly those of us who live in the north and are having cold winters and staying out of the sun. So I don't think it's a bad, but just going back, you build your skeleton, up till age 25 or 30, and then it's all downhill from there.
I hate to think of it that way, but it's probably the truth. And it's very important from that young age until the day we die to get off the couch, get away from that iPad, get off the couch, and be physically fit.
So exercise, calcium, vitamin D, and thinking about it early are really the keys, and that's all we have time for.
Thank you.
It's another way to stay healthy. If you have a question you'd like to ask on Health Talk, please contact us at healthtalk@northhealth.org.
Our thanks to Dr. Adam Ofer and Marina Richardson for coming on our show today. I'm Dr. Vicki Smetak.
I'm Dr. Eric Mazur. We'll both see you next week on Health Talk. Bye-bye.
Thank you.